Okay. So first, I just want to say hello. My name is Sarah Neely. I'm the nurse with the Community Health Worker Hub. And today we're going to be doing a Narcan training for you guys to use in the community at your community events and your community sites where you go each day. So I'm going to go ahead and share my screen so we can get started with that. All right. Also going to turn off my camera. Okay. So like I said, I'm the community health nurse with the Community Health Worker Hub. Before I was with the Hub, I spent several years working primarily with unhoused populations with serious mental illness at some of Russia's community partners. And while I was doing that, I was able to get my naloxone trainer certification through the Chicago Recovery Alliance in 2018. I have had to use the skills that I learned with CRA quite a bit. So hopefully this will come in handy for you as well. Before we get into the actual training portion, we do need to talk about the opioid crisis, both nationally and locally, and how that informs the harm reduction work that we do. I've added some definitions here of terms and abbreviations that you may hear throughout the presentation. I'm going to talk about them a little more in depth as we go through, and I'm sure many of them you already know. And I'll also send this slide deck out to you guys so that you can refer back to it if you need to later. One thing that you may hear me do throughout this presentation is say the words Narcan and naloxone interchangeably. Naloxone is just the generic form of Narcan and typically refers to the intramuscular injection version of the drug. We won't be focusing on that content today necessarily, but you do still have to learn about it a little bit since they are the same agent. Overdoses are on the rise nationwide. During the pandemic, the US saw record numbers of overdoses. There have also been an increase in synthetic opioids like fentanyl, which is causing overdose deaths. And this is why it's so important that we're doing this education today, as the Chicago Department of Public Health recommends increased naloxone education and distribution in the community in order to combat these statistics. As you can see from this graph here, from the CDC, it does show nationwide overdose deaths through January of 2021. I tried to find a graphic that included 2022 and 2023, but everything was surveillance from 2020 or earlier. So they did not have that. And this is just more of the same information, but on a state level from IDPH. The graph on the bottom right here shows statewide opioid overdose deaths from 2018 to 2020. And you can see by the gray line here at the top that up through May, 2020 was pretty significantly outpacing 2018 and 2019. Out of all overdose deaths in 2019, 80% of those were from opioids. And someone was more likely to die of an opioid overdose than of a car crash. Some groups are more vulnerable to opioid overdoses. It's the #1 cause of death for both people experiencing homelessness and people experiencing incarceration. People entering or leaving treatment for opioid use disorder are also particularly vulnerable to overdoses, as well as people living with HIV/AIDS. Opioids can be natural, semi-synthetic, or fully synthetic. Obviously, opioids are prescribed legitimately for people who need help with pain management, but these medications can be abused or misused if pain is not being managed appropriately or if dependence occurs. Sometimes people can build up a tolerance to opioids really fast, and the amount that they were prescribed no longer helps with their pain. So they may feel forced to self-treat that breakthrough pain instead of returning to their medical provider or pain management for help. Heroin is made from Asian poppy plants. Most of the world's supply of heroin comes from Afghanistan, but the heroin found in the US typically comes from Mexico or South America. Heroin is often cut with other substances like baking soda, laxatives, bleach, and sometimes other drugs like cocaine and PCP. This last part is especially important to note, especially when we're trying to reverse the effects of heroin with Narcan, because the Narcan will reverse the effects of the heroin, but not of the cocaine or the PCP. So the person overdosing may wake up and be agitated or belligerent. And we'll talk about this more in a later slide. But I like to remind people as often as I can to just be safe and aware of their surroundings when administering opioid reversal agents. Heroin can also be white, black tar, or yellow, and it can be smoked, inhaled, or injected intravenously. Fentanyl is 50 to 100 times stronger than heroin, and it can be made both illicitly or in a lab. Carfentanil is 100 times more potent than fentanyl, and it is primarily used to sedate large animals like elephants. It can be inhaled or absorbed topically through the skin. And it sounds so ridiculous that it kind of makes you think, like, are people actually using this? And yes, they are, but typically not on purpose. I was at a shelter last year and there was actually carfentanil in a man's heroin, and he overdosed. We also had some staff who came into contact with trace powder and collapsed, and they had to be rushed to the ED. I and a few others ended up wearing N95s and doubled up gloves, and we had to remove everything from the room, wipe it down with bleach. We found out later through CDPH actually that this type of thing had happened in spots all over the city that weekend. So there was a bad batch going around. Luckily, we were able to alert the folks at the shelters so that they could let their residents know, so that hopefully we could prevent more of this from happening. And here at the bottom, you can see the different levels of heroin, carfentanil, and fentanyl required to achieve the same effect. In Chicago, opioid overdoses disproportionately affect our Black and Brown populations. And the average age is 44 years old. So this issue is not just affecting our super young people. The neighborhoods most affected are Austin, North Lawndale, Humboldt Park, South Shore, Westtown, and Roseland. And as you can see, many of these are areas that we serve at Rush. Now we're going to talk about overdose recognition and response and Narcan utilization. This is the core content that is required for all Narcan training, and I'm just going to go over all the points here quickly. We'll be discussing the role of naloxone, recognition of potential opioid overdose, how to confirm if someone is unresponsive with the sternal rub, how to administer Narcan and how to call EMS, readministration of naloxone if response is inadequate, ensuring that the revived person is monitored for several hours, preferably in a medical setting, how to put someone in the rescue position, the importance of opioid abstinence and how to support access to treatment, how to utilize the drug overdose prevention program, the legal status of naloxone, and reports and refills, which are required for each administration of Narcan. Okay, so this is going to be the sciencey portion of the presentation. We all have opioid receptors in our brains, and certain things can cause us to have a pleasure response, like food or exercise. And some people refer to these as endorphins. When opioids go onto their receptor, and as you can see, the opioid molecule here fits perfectly on that receptor, it releases a cascade of dopamine that causes this pleasure response. Narcan is an opioid overdose antidote, and it works by competing with the opioid for that receptor. Like we saw on the previous slide, I kind of like to think of it like the naloxone molecule is playing king of the hill with the opioid molecule and knocking it off of its receptor. Excuse me. Narcan counteracts the effects of natural and synthetic opioids, including heroin, hydrocodone, oxycodone, morphine, methadone, and fentanyl. It's extremely safe. So if you give it to someone who isn't overdosing, nothing will happen to them. Because like we talked about, all the Narcan is doing is knocking the opioid off of its receptor. So it's not going to affect any other drugs that might be in the system, and it's not going to affect any body systems. But to that same point, if there is something else going on, or if the drug that they're overdosing on is not an opioid, naloxone is not going to help them either. So that's why it's important to call 911 immediately if someone is unresponsive. So you'll see an expiration date on the box of Narcan that you receive. The shelf life is about 2 years typically, and the half-life is about 30 to 90 minutes. I'm going to turn my camera back on really quick so I can show you my box of Narcan. Okay, hi. So this is what the box looks like. And then it's going to be in this black box up at the top. And the expiration date is right here, December of 2023. All right. And that'll be the same for all of you. And I see there's a question in the chat. Let's see. Do I have the median for this number too? Which number are you referring to? I'm so sorry.
It was a few slides back about you said the age was 44, and I was wondering if you also had the median for the age of folks who overdosed.
I don't for this presentation. I'm so sorry, but I can get it for you.
Thank you.
Yeah. All right. Now then. Okay. In terms of administration of Narcan, one size does not necessarily fit all. The effective dose is really going to depend on what drug the person took and how much they took. And you're like, how am I going to know what they took? You won't. But you will all be receiving intranasal Narcan. You'll know if the person responds, whether the dose was adequate. And we'll go over that more in a minute. Like I said before, there's also intramuscular naloxone. And that's what used to be dispensed for free in the community. But luckily, now that we have the Illinois Opioid Overdose Prevention Program, we have this wonderful nasal spray. So we do not have to deal with the needles. But naloxone can be given through an IV. It can be given subcutaneously. It can be given through the bone. There's no oral formulation of naloxone, so you can't, ingest it by mouth. And it should be stored at room temperature out of light. So just keep the Narcan that you receive in the box that it comes in. Narcan is not an addictive substance. It can't cause an overdose. The only reason that you wouldn't give naloxone is if someone was allergic, and that is extremely rare. And for our purposes here, I just wouldn't even worry about it. Clinical recommendations are to treat the opioid overdose and then reverse any allergic reaction afterwards. So EMS would be the people that would handle that. The only adverse effect of Narcan is opioid withdrawal. So you may see someone go immediately into withdrawal after administration. And again, we can talk more about that later. And Narcan cannot be used in place of medication-assisted treatment, although it is a component of Suboxone. Fun fact. All right, and this is just a picture of the naloxone kicking the opioid off of its receptor. It's important to note that, like I mentioned on the previous slide, Narcan's half-life is only 30 to 90 minutes. And the Narcan is just kicking the opioid off of its receptor. It's not eliminating the drugs from the system. So the opioids are still in the body, and they actually have a longer half-life than naloxone does. So that's why it's so important for the person to be monitored in a medical setting after an overdose, even if they have achieved a desired response after reversal with Narcan. Because if that Narcan wears off, you may start to notice that they start to exhibit signs of overdose again, and they might need additional medical attention. Signs and symptoms of an overdose include pinpoint pupils, stopped or slowed breathing, so fewer than 8 breaths per minute. And this is the real issue with opioid overdose, is the respiratory depression that it causes, because that can lead to respiratory failure, heart attack, stroke, and ultimately death. And then you may also hear weird noises like gurgling or choking sounds in an attempt to breathe. They'll be unresponsive and unable to speak. They may have blue lips or fingertips due to the loss of oxygen from not being able to breathe. And they'll have cold, clammy skin. Here's a chart to help you determine whether a person is overdosing or just really high. If someone is really high, they're probably nodding off, but they can be aroused. And their speech may be slurred, but they can speak. Their breathing will be more than that 8 breaths a minute. If you come across someone who is really high, just monitor them for a while to make sure they don't go into overdose. Count their breaths every once in a while. And if their breathing goes below that 8 breaths a minute, call 911. To stimulate an unresponsive person, you're going to use the sternal rub. To do this, you make a fist and use your knuckles to push against the breastbone and rub. I'm actually going to turn my camera on again. Oh, I see this question. Great questions. How many Narcans can you use on a person if it does wear off? So typically the rule of thumb is 3, but I have seen people use up to 6 when EMS was taking a while to get there. Oops. Hold on. Sorry, guys. I'm trying to figure out how to put my camera back on. All right. Can you see me?
No.
No? Okay, cool. Try this again. I'm just gonna. Oops. That doesn't work either. The heck? You guys. Okay, now can you see me?
Yes.
Great. Thanks, guys. Okay. So to do the sternal rub, make your hand into a fist and really firmly rub. You can also do the collarbone, which hurts a lot. So if they're responsive, they will definitely respond to that. I'm going to put the presentation back up. All right. And yes, you want to be super firm when you do it, but don't push too hard like you're doing CPR. You don't want to cause any kind of damage. And if there's no response, give Narcan and call 911. If there is a response, watch them for a while, make sure they're still breathing more than the 8 breaths a minute. Okay. So sometimes when you find a person overdosing, they might not be on the floor. They might be slumped over in a chair or on a couch. And in that case, you might have to lift their head to assess their breathing and deliver the sternal rub. Before giving the sternal rub, also try to give them a heads up just in case they're just sleeping or they are really high. Tap them on the shoulder, shake their shoulders. Be assertive and say, hello, can you hear me? Are you okay? If there's no response from that, then go into the sternal rub. Okay. I know that at this point, I probably sound like a broken record, but you have to call 911 anytime you administer Narcan. When it comes to giving naloxone and calling 911, do whichever one you can do first. Ideally, you would want to be with a buddy so that you can divide and conquer. One person can call and the other person administers the Narcan. But if you are alone, call 911 on speaker if possible. And while you're calling, administer the Narcan. And this is just an example of something that you can say while you're calling. Hello, my name is Sarah Neely. I'm at 600 South Paulina Street. I have someone here who is unresponsive and requires an ambulance. Sometimes when you call 911 and you say that someone is overdosing, and this is just in my experience, emergency responders can kind of take their time getting to you. And for this reason, I typically recommend saying that the person is unresponsive in order to get them care as quickly as possible. So I know that you're not going to have intramuscular naloxone, but it is part of the required core content for training. If you ever do have IM naloxone at a site where you work, please take a needle safety course in addition to this training, or take an in-person naloxone training that has a hands-on component. For people who have never used a needle before, it can be a little bit scary. I have been both the recipient and the perpetrator of accidental needle sticks at work, and it's a lot of paperwork and a lot of grief, and you have to take medication. So it's just best to be on the safe side. We'll just go over this super quick, and I will turn my camera back on if it'll let me. Ha. Nice. Hi, guys. All right. So this is an expired vial of naloxone. In order to draw it up, in the kit, you're provided with a syringe. Take out the syringe. Ooh, the whole head came off. There we go. All right. So here's the vial. Pop off the orange cap. You will put this on a solid surface, but I don't have a solid surface that you can see from this angle. So I'm going to hold it like this, but do not do what I'm doing. Take off the cap of the needle, insert it into the vial. Make sure that the needle is in the liquid. So if you're poking it out like this, it's not going to suck anything up. You want the tip of the needle to be in the liquid. And then draw up. You draw up the whole contents of the needle. Make sure there are no bubbles. If there are, tap, 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 tap. Just go. Push them out a little bit. But it should be exactly 1 milliliter. You can see this is exactly 1 milliliter. All right, so we're not using this.
I have a question.
Absolutely.
Would you say that the whole needle is in, or is it only like the tip of it in order to get the liquid?
So that's a good question. To stab it, push the whole thing in because you don't want to stab yourself or stab, something that you don't mean to, because the needle is sterile. So put the needle all the way in and then withdraw just a bit. So it's just the tip and pull back like that.
Okay, thank you.
Sure. For the most part, you guys won't need to worry about this because this is, you're not going to be having the IM version of naloxone. But if you do, I just wanted you to see it. And then with the needle, you will dispose of it immediately. After you poke the person, throw it in a needle safe container, either like a Pepsi bottle, or if you have a Sharps container, use that. Alrighty. Cool. And then you'll inject it into either the deltoid muscle or the outer thigh, whichever is easier. Like if it's wintertime and everyone's wearing heavy coats, it might be easier to go through a pant leg. Or if it's the summertime and everybody's wearing short sleeves, the deltoid might be easier to get to. And you can go through clothing. You don't need to undress anybody here for this. And there is a link below right here to a YouTube video if you want to review this further. And again, I will be sending this deck out to everybody. Okay, and this is what you're gonna have. For intranasal Narcan, I'm gonna show you this as well. Okay, so again, the box looks like this, and inside of each box are 2 devices. The devices come in these plastic containers like this. To use it, you peel back. This is used, so I just have it kind of laying around. Peel it back, and inside the device looks like this, and there's like a little red thing sticking out in the middle. So you'll put peace sign, put your fingers on the wings, put your thumb on the plunger, and put it inside the tip of their nose, and you just squirt. And when you squirt, it'll spray a solution out. And you'll know if it's used or if it worked because it sticks. So it won't come back out. And then if you get nervous while you're doing this, the lovely people who made Narcan have made it very easy for you, because on the box, there's a flap in the front that you can open, and it has instructions. There are also paper fold out instructions in the box that are very thorough. And then inside of the plastic that the actual device comes in, there are even more fold out instructions for you to use. So to make sure that you definitely don't forget. And then you can just dispose of the device in any container that is away from children. So that's what they say. So you can throw it in a trash can, throw it in a dumpster, just somewhere where, you know, a small child isn't going to be able to get to it. All right. Okay. So after delivery of the Narcan, we used to say to do rescue breathing. But with COVID-19, that is no longer recommended. If you are trained and you feel comfortable, you can do chest compressions on someone who is unresponsive until the paramedics show up. If you remember from CPR training, once you begin chest compressions, you cannot stop. So try to have a buddy or just someone else nearby that you can trade off with, because you will get tired, especially if EMS is taking a while to get there. And if you haven't gotten a response in 2 to 3 minutes, give another dose of Narcan. And you may even need to give a third dose in another 2 to 3 minutes. After administration, if you're not doing chest compressions, then you will need to put the patient in the recovery position. This is to keep the patient from choking in case they vomit or they have something in their mouth. You'll roll them onto their side like you see here. Put the arm that is on the floor, extend that out all the way. Cross that top arm in front of them. Extend their bottom leg long, and then bend their top leg a little bit, about 45 degrees, in order to support them and keep them from falling over. I always like to add a little something extra, like a backpack or a chair behind them for extra support, just in case. Now, I just want to touch on this. If and when a person does respond, they are going to feel sick. They will possibly be pretty upset. I do recommend that when you're giving Narcan and the person begins to respond, to back up a little bit. Sometimes the person will pop up and run away, or they may be on another drug as well, like we talked about before with the cocaine and the PCP, and they could be belligerent. So it's important that you're safe as well. And then the person may also go back into an overdose after that half-life. So you might need to administer another dose of Narcan. And again, it's important for this person to be monitored in a medical setting for several hours. After an overdose, a person may be particularly motivated to seek treatment. And this makes sense, right? Like they've just had a really scary experience where they almost lost their life. So this is a great opportunity to bring up medication-assisted treatment, or MAT. Methadone and buprenorphine are both very effective treatments for substance use disorder. There's also SAMHSA's resource locator and national helpline. Often the people who work these helplines are also in recovery, and it can be really nice to speak to someone who's successfully in recovery and can understand their experiences that they've been through. I've also put some additional resources through some of our community partners on this slide here at the bottom. People with opioid use disorders often don't seek treatment, not necessarily because they don't want it, but because they don't know where to go or how to ask for it. So having these resources available can be extremely helpful. So how do you get naloxone or Narcan in our case? Here at Rush. But we also have the Chicago Recovery Alliance as a resource for individuals, and any hospital or community organization can register for free Narcan through the Illinois Opioid Overdose Prevention Program. So if you or someone you work with is experiencing opioid use disorder, just talk to the primary care provider and ask them to write a prescription for Narcan. It's free at any dispensing pharmacy with a prescription, and it's a really excellent way to reduce harm. All right. In 2010, Illinois passed the Good Samaritan Law, which makes it legal for anybody to carry naloxone. You can carry it, you can administer it. The only oh no is that you cannot ask for money from the person that you revived for saving their life. You will be receiving intranasal Narcan. So again, I'm not going to go over this in detail, but I do want to stress that if you end up working somewhere that has the injectable form of naloxone, that you take a needle safety course. We don't need you going to the hospital with the patient. That is not the goal. If you are using a needle, always wear gloves and dispose of the needle immediately after use. Most of the intramuscular naloxone kits don't come with a safety, like you see right here, this pink one. So keep a milk jug, Sharps box, Coke bottle, whatever you've got. Keep that kind of on the floor, or on wherever you are working in your office. Do not put needles in the trash can, as that could expose someone to biohazardous material. People may be at a higher risk for overdose if they mix drugs together or if their tolerance changes. So if they stopped using for a while and then they tried to use the amount that they used before they quit, that might lead to an overdose. The quality of the drug, like Xanax, is not fentanyl. So if someone takes fentanyl that was made to look like Xanax, that gives a high potential for an overdose. Using alone, physical health conditions, how they take it, do they smoke it, do they snort it, do they inject it, and previous overdoses. All of these things put people at a higher risk. You are required to report any Narcan administration to the Department of Human Services. And I have a link here where you can do that. It's really simple. They've made it to where you can do it online. So yeah. Lastly, there are a lot of myths surrounding what to do when someone is overdosing, but don't do those things, and tell the people that you talk to in the community not to do these things. Don't put an overdosing person in a bath or try to make them vomit or hit them or inject them with various substances. I know that there has been a rumor that you can inject someone who's overdosing on opioids with saline water that you make at home. That does not work. But you can deliver Narcan and use the skills that you've learned today. And we can encourage community members that we come in contact with to get Narcan if they are around, if they or someone they know uses opioids. All right, so thank you guys for attending this presentation. I hope that you all feel a little bit better prepared to recognize and respond to overdoses. I do have a few minutes to allow for questions if anybody has them. So yeah, any questions for me before we wrap up? And I can take them in the chat too. You can also feel free to email me anytime. Just type my name, Sarah Neely, into the email bar and I'll pop up. All right. So thank you all so much. Like I said, I'll send out the info with the slide deck, and I will let your leads know that you were present at this training so that you get credit. Otherwise, have a wonderful rest of your day, and I'll hopefully see you soon.
Thank you very much.
Thank you. Bye, everyone.